From mobility to healthcare, Mr. Jérôme Tass will join us now from Amsterdam. He is Chief of Strategy and Innovation at Royal Philips. Happy to have you with us, Mr. Jérôme Tass.
Thanks so much, and it's indeed my pleasure to join you here on what I consider to be a very important topic. And first, I would like to thank the organizers of GAIA X with this extremely important initiatives, and I hope I'll make it clear to you that this can potentially have a huge impact on the way we deliver healthcare and the way we innovate around healthcare. But first, before I start, I really would like to give my appreciations for those people in the healthcare space that dedicate their lives to saving the lives of others. And we see that every day. Here in Europe, we're in the middle of the second wave. And as you can see, I'm coming to you virtually from my home. And I think it shows us that we're in a different world than we were almost half a year ago. So let me start out what we see happening around us in healthcare, and then obviously I'll map that back to what we believe GAIA X can be and help us to enable a way better healthcare system. And I'll also try to put it in context of what we can see in other parts of the world, because as Philips, we're a health tech company, but we operate around the globe, and we're present in China, we're present in the United States, and we can see how people are investing in cloud and data spaces to actually enable better care. But let me start with giving you a snapshot of the world of healthcare. And in the European Union, we spend about 10% of our GDP on healthcare services. And what we've seen in the past couple of years is that continues to rise. So actually, the spend on healthcare is exceeding our GDP growth. So that means that we'll create a lot of pressure on budgets to still deliver world-class care. Now, on top of that, we obviously have aging populations in part of the EU. We see the rise of chronic illnesses, and we see these illnesses actually clogging up the system. And lastly, the pandemic has taught us that we can be confronted from the left field with a pandemic that impacts everything, and specifically our ability to care for those patients who suffer from infection and end up in the intensive care unit, sometimes undergoing very complex procedures to get them well. But the reality is that around the EU, we're operating in a highly fragmented healthcare system. And when we started addressing the issues around the pandemic and trying to understand how the pandemic spreads, how the virus interacts with existing disease, so as heart failure, diabetes, or immune diseases, as we try to create the protocols that best cared for those patients in intensive care units, ventilation, medication. And as we try to find the vaccines that could counter this pandemic, we could see that it was really hard to bring that information together, to have a deep insight in how the pandemic spreads and which parts of the populations are at risk, so that we could proactively reach out to them and care for them and avoid visits to the hospital. At the same time, while we were treating, or we are treating, those patients infected with COVID, we also have to take care of the regular care. So we also have to make sure that people suffering from heart disease or people suffering from cancer can still be treated without the risk of infection. Now, all of this has been due to the fact also that the incentives in the healthcare system haven't been pushing towards that deeper collaboration or more preventative care. And most of the healthcare systems in the EU are still based on what's called a fee-for-service system. So we're actually paying for consults, for diagnostic tests, for procedures, for medication, and for care. We're not paying for outcomes. And as we move towards outcomes, we get also forced to have deeper insights in the risk stratifications of people, the needs they have for healthcare, and the need to become preventative in the way we treat them. So as we ground our healthcare system more on shared data, on deeper insights in risks, disease, and care, we can also become more proactive and we can drive towards outcomes. Now, lastly, we've seen that many of the data that gets generated in healthcare, and there's a whole lot of data, and much of it is, by the way, not structured. So these are doctor notes, clinical reports, or images. Much of that data lives in silos, even within a hospital, let alone within a care system. So I think what we want to drive for is making sure that we embrace the digital world. We embrace virtual care, where we can actually guide patients based on insights. That we make sure that that data is fully semantically interoperable so that we can understand it, share it. And what we can do is better leverage the technology. And you see some examples here of the use cases that immediately are served by cloud-based systems, by deeper insights in patients, and by the applications of sensor technologies, Internet of Things, as well as artificial intelligence. And artificial intelligence will be one of the key drivers in innovation in care, already applied today. But as everybody knows on this conference, artificial intelligence totally depends on the data, the interoperability of the data, the scope and size of the data sets, and the ability to apply innovation, shared innovation, to progress the agenda there. And I think that's when Gaia X comes into play. And to do that, we have to understand that the healthcare system needs to be really oriented towards the citizens, the consumer, the patient. Like in the previous speaker talked about the traveler at the center, we also see that the citizen needs to be at the center. And everybody who has chronic disease or has undergone healthcare procedures has been dealing with the diversity of providers, dealing with payers and reimbursement, has been dealing with diagnostics, has been dealing with primary care. So what we see is actually an environment in which the citizen becomes the center, and the citizen carries the data with them. And that data is longitudinal in nature, which essentially means that it includes the information gleaned from an imaging study, a blood test, a primary care visit, a genomic sequence, but also the insights into a procedure and the outcome of those procedures. So that will allow us then not only to guide that citizen better in their care, to tune the care to their needs, and to guide them through the system, but also to aggregate that data so that that aggregated, anonymized data can be used to create the deeper insights that helps us to find the drivers of disease, to find the drivers of health, and translate that into almost a personalized health pathway for each citizen. Now, in order to do that, we need a system, we need a platform. And that platform can be provided by Gaia X. And if we look at the concept of Gaia X, is obviously at the bottom, the ability to have secured, portable, open services that allow us to create what we want to do at the top. And at the top, we really want to create these portable health records. And the previous speaker was talking about a travel record. What if we could combine a travel record with a health record and thereby dramatically improve the safety of travel around the EU? What we've also seen is that when a pandemic hits, it's really important to understand where the risk is, where the key resources are. This can be as simple as PPE or ventilators or monitors or testing equipment. But it can be as complex as really understanding who should be admitted to an intensive care unit, who should be guided to an extended care unit. How can we glean through data that they're actually stabilizing? How can we then stick one of those wearable monitors on them so that they can go home and we can almost treat them as if it's an ICU bed in your own home? And these care command centers basically allows us to match the needs, the acuity of patients to the resources in the healthcare system in a much more seamless way. Now that's underpinned with virtual care, because if we see that a patient has COVID in an intensive care unit and we see issues on their lungs because maybe on a CT scan we've seen, using AI, quantify the disease, we can click on a button and we can ask a pulmonologist to help with the triage of that patient through virtual care. That virtual care in turn allows us to monitor at scale, to tap into networks of caregivers, and then use artificial intelligence to optimize, to automate, and to guide these clinical decisions. And lastly, to enable these clinical trials that don't stop once the vaccine has been determined to be safe and ready for distribution, but also to see how the vaccine interacts with different types of patients, with different cohorts of patients, and feed that back into the pharma process. Now, in order to do that, we need to have access to all of that data, but that data has to be anonymized. So we need the tools and the rules for anonymization. We need the tools and the rules for consent, because clearly privacy is a very important aspect of this. And we need the tools and the rules for semantical interoperability. Make sure that if we share information, diagnostic information, treatment information, protocol information, we can interpret it in the same way. Now, that data will obviously not be in one place. It will be federated, and therefore we need the federation services specifically for healthcare. And lastly, we need to enable a platform that allows the analytics to play into that opportunity. Now, as you can see in this picture, this will entirely be based on a Gaia X type of infrastructure. And we can even think about sharing digital identities, sharing consumable cloud services, but tune them to the regulatory and data needs of healthcare. Now, that brings me to what we consider to be the next steps. And I'm happy to say that I'm joined with many of the key stakeholders in healthcare in the EU, really understanding the importance and the need to do this. And the importance and the need is first and foremost to alleviate the pressure on the EU healthcare systems. We're in the middle of a pandemic. There's tremendous pressure on the frontline workers. There's a tremendous need of insight in the disease and the data accompanying that. And there's an opportunity to do this in a way that we can become truly competitive on a world stage. And the data in the EU is typically of very high quality, but is locked up in silos. So if we engage the key stakeholders, and in healthcare, there are many stakeholders, they're obviously first and foremost the patients, the providers, the pharma industry, and we have a very strong pharma industry in the EU, the payers, the people who actually pay for the care, the regulators that set the safety and efficacy standards, governments that can promote this, and last and not least, the healthcare innovators, because there's a whole new world emerging around artificial intelligence, virtual care, deeper insights in disease, and shared pathways that constantly learn from the data. So every diagnosis, every treatment becomes a learning point. So we suggest that we launch this EU federated health data space and cloud consortium in the context of Gaia X. and like our colleagues in the other industries, develop a compliant by design framework. Because if we build in the security standards, the privacy standards, and the regulatory data safety standards that are associated with healthcare, this will take away a lot of the load actually on the people trying to build the systems to support this. So having a system that works and that allows us to consume those services very easily will prompt not only better healthcare and deeper insights, I think it will also lead in a new age of innovation in healthcare. And I personally believe that Gaia X plays a lead role in this, and we're very happy to support this major initiative. Thank you.